Dr. Jason Hahn is GRMC's otolaryngologist, an ENT physician who specializes in ailments of the ear, nose, and throat.
I think the most important thing is just kind of getting a feeling of how the patient looks. If they're in discomfort or distress versus if they're comfortable, you can just gain a lot just by just observing someone. I start off my ENT exam with ears, and we use a basic otoscope and look in the ears on both sides, regardless of if their complaints on one side or another. And I'm looking for if there's any signs of infection, if there's any fluid behind the ears or any foreign bodies, wax, anything that could be concerning that could be causing problems in the ear. Then I do a gross hearing test. I ask the patient if they can hear equally in both sides, and I usually take a tuning fork or my fingers rubbing together, and that kind of gives me a sense if there's truly an issue. Then we take a look in their nose, and we have with a headlight on and it's nasal speculum to open up the nasal passages. I take a good look in the anterior part of their nose and look for if there's any drainage, masses, anything suspicious at all. I think a lot of times physicians are in a hurry and we tend to just kind of go to our exam and make our decisions, but a lot of times patients, if they're having a problem, they've kind of thought about it, they can be a gold mine for information. So that's probably the biggest thing, actually talking to them and figuring out the time course of their problems, how long, how severe. And then the physical exam just kind of confirms what you see. Your general practitioner will look in your ear for an ear problem, but if they don't see anything, there's obviously things that can be deeper and that they can't see, and there's some equipment that we have with a microscope that we're able to look more detailed at problems. That device behind me is what we call the Pentax video strobe. It's a special device that really allows us to look down one's voice box. We get patients that come in that say that they're having problems with their voice, they're hoarse, they have pain in their throat. This machine here basically has a high definition chip and has a stronger light, so it's able to take a look down your voice box in high definition and in video and in slow motion. There's also another where we have a transnasal esophagoscope, so it allows look at someone's esophagus and stomach by going through the nose. There are patients that really don't want to have general anesthesia. There are patients that can't tolerate getting general anesthesia just due to their health reasons. Here, we're able to numb someone's nose and throat up and pass a scope while they're awake and take a look down their esophagus and their stomach. So in this room here, this is what we call our ear room. Once a patient's identified to have some sort of concerning ear problem, I like to take a closer look. And when I do that, I take them to the ear room here where we have our microscope. And our microscope is a Zeiss microscope, which is one of the top of the line microscopes. And what it allows me to do is take a look at the ear closely under high magnification and high illumination. It allows me the freedom to manipulate the ear. It puts some things in the ear to suck out things, remove things, and do procedures in the ear that you can't do otherwise. Something that we really can offer people that have sudden hearing loss. We're able to do a procedure where we make an incision in the eardrum and inject steroids and actually give them a good chance of recovering their hearing.
Among the most severe cancers Dr. Hahn has seen are cancers caused by betel nut chewing.
Probably the biggest cancers are probably the betel nut. People that chew betel nuts, I've seen two people with like basically holes in their cheeks due to the cancer. They should have came in earlier. But on Guam, what happens is that patients kind of delay coming in, so it's very late presentation. The first time you notice anything that's unusual, I would recommend seeking care. Maybe that's at the level of your primary care doctor, but then if they recommend you to go see a specialist, including an ENT, I recommend you following through and making that appointment. I think the biggest thing that we can offer them is an opportunity to look down in their small passages in their throat and their nose, and even take biopsies if need be for patients that need the first step in a long process in diagnosing and treating their conditions. Everything in this kind of region is, the anatomy is interesting because there's a lot of blood vessels and more importantly nerves that kind of control how things look. So it's a very complicated area. It's an area that has a lot of anatomy, a lot of things can go wrong. So that's part of the reason why I enjoy the specialty, because there's a lot of variety, because every day can be different.